Hi guys, hope you're ready for today's quiz. We'll be starting the quiz at exactly 10:10 p.m. as scheduled. Today's topic is pediatrics.
Hi guys, welcome back. Please join the quiz using the QR code or the link provided, and we'll be having a quiz on whole of systemic pediatrics.
Yes, guys, we'll be starting the quiz exactly at 10:10 p.m. I hope everyone has buckled up and has revised the topic, systemic pediatrics.
Everyone, please join the quiz. The link for the quiz is shared in a Telegram group, and also you can scan the QR code visible on the screen and join the quiz.
Guys, to join the quiz, you can just scan the QR code or you can type the website shown at your screen. Or any other queries or any other thing that you would like us to discuss at all, please comment it in the comment section on the YouTube. We are ready to answer.
Quiz link is also shared now in the comment section of the YouTube video, YouTube Live. And quiz will start exactly at 10:10 p.m. Quiz link is shared in the YouTube Live comment section.
And also, guys, just to remind, there is no negative marking in the quiz. So all of you who have joined the quiz can answer without the fear of negative marking, because some of them just attend the quiz but not the don't give the answers. So you all can attend.
If you have any doubt, you can ask in the YouTube Live comment section. We'll be monitoring your comments in the YouTube Live comment section also.
Guys, we would love to hear your feedback as well. Like, what do you like and what do you want to do next? So please let us know. We would be very much thrilled to hear from your end.
Yeah. Yes, guys, your feedbacks are most welcome.
Guys, only 3 minutes to go. We'll be starting the quiz at exact 10:10 p.m. So can you see? We have Kendrick Lamar also. Let's see if you can wrap up in the top with the Queen. All right.
Where is king then? Queen is here. There is no king.
There's no king.
Someone will come up with that name also.
There is no prince also.
Where did the princesses go and princess and
Yes,
prince?
there is Thorn Princess, and there was one more name, right, yesterday, which was catchy.
Oh, yes. So your name only. I thought you are the one who's playing, and we'll be giving you the winner thing also.
You should have Trump and also Trump, Narendra Modi.
All right. Kendrick
Those who
Lamar, please
join,
let us know your. Yeah, yeah.
those who
Please
want to
let us
join
know
the
your
quiz
new
after
rap.
those who want to join the quiz after the quiz starts, you can also join, but you will be directed to the question which will appear on the screen. You won't be able to attempt questions from the beginning. Okay.
Right, because it's a live session, and over here, it's only a way forward. Like every time in your life, it is always a way forward. Some ahead.
Yeah, please bring your friends or drag them to the quiz. It's a good way to end the day.
That's true. Imagine just revising everything you have read, and then you're also, scoring also, feeling validated also, getting these nice text also. So it's a good thing.
Yeah,
All right, guys, your last minute on the go.
there's already a winner in our quiz.
Yes, yesterday
Do you know this?
also.
But yesterday, sadly, the winner lost.
Ah. Oof. All right, guys. So we'll be starting the quiz now. It's time to go. Let's go. It's 10:10 p.m.
Yes. Let's start. So, hello everyone, and welcome to JuxtaMed quiz on systemic pediatrics. I am Dr. RMD, and joining me today are Dr. Rupal and Dr. Manoj. We are excited to bring you a good set of questions. So, let's dive in.
Yeah, absolutely. Let's see who gets the answers right first.
You know what? I can't wait. These questions will definitely get everyone thinking. So let's get started.
Here is your first
Yeah.
question of the day. An easy question to start with. A 7-month-old infant presents with acute watery diarrhea for past 2 days. Child is alert but shows signs of mild dehydration. So, what is the appropriate management? And you have four options. Your time starts now.
Yeah, for to give a clue for mild dehydration, the first step is always oral rehydration therapy.
Right. And I would say to closely monitor the child would, help us to tell us more about the dehydration and wanting you to avoid IV fluids.
Yes.
Yes, majority have got it
Okay.
right.
Wonderful.
Okay. So, Ghost is leading, followed by Kendrick Lamar. Yes, then Soumya and Hemant.
You should have been
So,
Ghost Rider, sir.
so Let's start following the ghost now.
Alright.
The ghost is riding the show. Okay, let's move on to next question.
A 7-year-old child is brought to the clinic for frequent episodes of sudden staring, lasting for few seconds, followed by a quick return to normal activity. What's the first line treatment for this condition?
I think we are likely dealing with absent seizures. The first line treatment is etosuximide, and if needed, valproate can be an alternative.
Yeah, that's right. For absence seizure, we have valproate and ethosuximide. But the problem with the ethosuximide, it is not available readily in Indian market. That's why we prefer always
Oh,
sodium valproate, followed by we can put yeah, for absence seizure, sodium valproate is a drug of choice in Indian setting. Ethosuximide is very rarely available. That's why we prefer valproate. Suppose the question was GTCS, then the answer would have been initially we about seizure using midazolam or we'll give lorazepam
Loras.
followed by phenytoin,
mm,
fosphenytoin, and the cycle continues. That is for status epilepticus. But right now we can use
right.
better drugs also like levetiracetam is also used. So in our setup we use levetiracetam initially because it has lower side effect profile.
Mhm.
So Ghost is leading, followed by
Interesting.
Sanmoga Priya, Hemant, SM, and Soumya. Good going, guys.
Yes. Moving on to your third question. Mumps can lead to hydrocephalus primarily due to which of the following mechanism? What do you
Yeah,
think, Dr.
mums
Manoj?
can I think mums can cause meningoencephalitis, which leads to CSF obstruction, resulting in hydrocephalus.
Yes,
Hmm. I I think
mumps.
we're just telling them the answers. So now,
Yes, so it is obstruction of the cerebral aqueduct, which is the correct answer. However, mumps hydrocephalus is very rare. I haven't seen any till now, though I had seen so many cases of hydrocephalus. So it's very difficult to isolate mumps virus as such, but mumps is a known cause of aseptic meningitis and hydrocephalus. So majority have got it right, and it's a PYQ.
Mhm.
So
Yes,
SM
right.
is leading now, followed by Soumya, Shanmugapriyan, Malcolm, and Rakshaya. So moving on to the next
See,
question.
guys, I agree. It's a cutthroat competition. Let's buckle up. You have many more questions to go.
Straightforward question. Fragile X syndrome, what is the mutation? Patho question plus pediatrics question.
Genetics,
Yeah.
Yeah,
right?
true, sir. I think these
That's
are the
correct.
very important one-liners.
Yeah.
That's
Those who
true.
know the
That's
answer, you can comment in the YouTube comment section also. And rest of the mutation, the BN1, MESP2, and FGFR3 mutations, you can comment in the comment section. Okay, majority have got them right. FMR1. One more commonly
so
asked
it.
question in Fragile X is which is the most common congenital cause of mental retardation after Down syndrome. Second most common cause is yeah, this one, Fragile X syndrome. It is also the most common X-linked disorder which causes mental retardation. So these two questions
Mm,
are very frequently asked. And Fragile X syndrome, it is easy to remember the symptoms. Everything will be big. Like there will be a large triangular face, there will be large ears, there will be large testes. So this is how you remember.
Mhm.
mm, nice. Thank you. I'll remember now. All right. Moving on to your leaderboard, we have SM with the longest streak, followed by Malcolm, Sangupriya, Soumya, and Kaushal. Nice. Very good. Very good, guys. Remember, the faster you answer, the more points you get. There is no negative marking. Free, feel free to opt your answers. So, moving on to your next question.
Here comes your fifth one. Which of the following chromosomal abnormality most commonly results in a patient that has the following finding as given in the image?
So you have two questions integrated into one. One is you have to identify what is the diagnosis, And second, you have to identify which is a chromosomal abnormality.
I think most likely Down syndrome is marked by these features like flat facial profile, hypertonia, and the single palmar crease.
Yeah.
Nice. So almost everyone has got this right, guys. These are your repeated PYTs. Like you got to know them by your heart. It's actually that way.
SM is leading, followed by Shanmugapriyan, Malcolm, Soumya, and Surya. So let's move on to the next question.
Which of the following differentiates omphalocele from gastrosis? Hey, this is a very baby questions.
Yeah. Omphalocele, you can remember that it is contained in a sac, on contrary to the gastrochesis.
Mhm.
How I used to remember was omphalocele O. O is like round, so it is covered. There is
Yeah,
no open
yes,
end.
yes.
G is there is
Good.
an open end in G, capital letter J.
Mm.
Ooh, that's nice way to remember.
SM has come prepared. He or she has the longest streak, followed by Soumya, Surya, Kushal, Tanya, Vishnupriya, Shanmugapriya, Malcolm, Rakshaya, Pooja, and Rakesh.
Oof. Let's go, guys. Let's go. Few more questions.
In which septal defect is right atrial size enlarged and has a wide fixed splitting of S2? This is a straightforward question.
Yeah. And to give a clue here, the left atrium size does not increase.
Hmm. I see wide and splitting of S2 is a diagnostic sign. It
Yeah.
does not change with respiration.
I've seen so many cases of S2, but I couldn't appreciate the wide splitting sound of S2 so far. Like it is so difficult to like because in adults it is easy, but in children it is bit difficult because normal heart rate in children is above 100, right? So
Right.
when you auscultate when the heart rate is above
Yes.
100, it is very difficult to appreciate the heart sounds. So
Hmm.
most of these children with atrial septal defect, they'll come at the preschool age, that is after 5 years, 7 years. Most of them are diagnosed at that stage because it is usually asymptomatic unless it is a large ESD. So when there is a large shunt,
Mm.
then there will be more shunting from left side to right side. So there will be more blood on the right side, and then there will be increase in right atrial size. Okay, that is the main thing. In VST, you won't find this because the shunt is at ventricular level.
Oh,
Mm.
that's okay.
So the scoreboard remains pretty much the same.
Okay, moving on to the next question. In a patient with steroid-resistant nephrotic syndrome, which of the following treatment is most commonly used as the next step?
I would say tracrolimus is the most common treatment used for the steroid-resistant nephrotic syndrome, and it's an immunosuppressant that helps to reduce proteinuria.
Yeah.
Is that right, sir?
Yeah, first thing we need to notice what is steroid resistant nephrotic syndrome. So any nephrotic syndrome which is not responding even after 4 weeks of steroid, sorry, 6 weeks of steroid therapy. Okay, actually you might find some discrepancies in your entrance books. Earlier it was response within 4 weeks. Okay, till 2021. In 2021 the guidelines changed. So in 2020 since 2021 we are considering steroid resistant when after starting steroids there is no response for 6 weeks. So right now, yeah, after 6 weeks, if you don't have any response, you classify it as SRNS. You do a kidney biopsy first. Okay, that also can be asked as a question, and then you start tacrolimus or cyclosporin. Okay, MMF is used for frequently relapsing nephrotic syndrome.
Oh,
So you can
okay.
expect a question on the duration of steroid resistance because this has changed since last 2 years only. And
New
because AIMS
topics in
makes
the
this
peak.
guidelines, yeah, mainly AIMS makes it, this ISPN guidelines, Indian Society of Pediatric Nephrology guidelines. So that's why INICET questions, you can expect this question on steroid assistance.
Is there
Right now, Surya is leading.
any
Yeah,
doubt albumin changes
sorry.
the level of albumin plus on the
Your
level of
voice.
albumin less
Uh,
level
level of
yeah.
albumin, earlier it was 2.5, now they've increased to 3. And one more important thing is earlier definition of nephrotic syndrome included
Okay.
4 components. That is, there was edema, hypoalbuminemia, nephrotic range proteinuria, and there was hypertriglyceridemia, right? Hypercholesterolemia. But now they have removed this
Yes, yes,
hyperlipidemia from the
yes.
diagnosis. Now there is only 3 diagnoses, like 3 pointers toward diagnosis. Hyperlipidemia is not a criteria right now.
Okay, sir.
Oh,
And the cutoff for
Mhm.
albumin is less than
Right.
3 gram. Earlier it was less than 2.5.
oh,
These basic things will be
okay.
asked in exam.
Gotcha.
Yes, yes, sir.
So moving on to your ninth question, the second last. At what age does the anterior frontal limb typically close in an healthy infant? Guys, this is a baby question, like
Yeah,
real,
this is
real
a
baby
very
question.
important.
Yeah.
Yeah, this is also a very important fertilizer, which gives you many other uh, any disease
Yeah.
for
So the top question. In some books it mentions
dehydration.
18 to 24 also, but anyways not after 24 years. And also causes of anterior fontanelle is also repeatedly asked.
Oh, right. So, guys, when we say it's a baby question, it means that you got to know this, and plus, you should be by heart also, and you should not at all get these one right, because these are the ones that will actually give you the marks and an extra edge in this cutthroat competition. All right.
Moving
We
on to
have
So,
the next question.
Surya leading now. Yeah.
Yeah, Surya is leading now. Yeah.
followed by SM and Raksha Vasudeva and Soumya and Sangum Priya and Surya with the longest streak of 9. 9 answers, all right. Let's see if we can get the last one right.
Newborn presents with excessive drooling, coughing. So, and the following thing is noted in X-ray. That is what you're saying is NG tube. Okay. So, what is the most likely diagnosis?
Yeah, from the symptoms and the X-ray, I think it's esophageal fistula. And guys, please comment which is the most common type.
Yes.
There's a difference here, guys. Oof, nice. They were not tricked.
In pyloric stenosis, you will see that there is a single gas bubble that you'll see. In Hirschsprung disease, there will be history of not passing stools. And intestinal malrotation, you won't get many questions on this. Okay. So it will be mainly embryology based questions.
All right.
Yes. Surya is the winner, and congrats, Surya, for maintaining the longest streak.
Yeah, congrats,
Congratulations,
Surya.
Dr. Surya.
I'm not able to give applause because of some reason.
We are giving you applause on our end. Don't worry.
Yes.
You're very happy. So,
Followed by
congratulations, Dr. Surya. Yes. Followed by SM and Raksha Vasudeva.
at fourth position, we
So,
have
good job,
Soumya,
guys.
Malcolm,
Yes.
Sarmugapriyan, Vishnupriya, Kushal, Rakesh, and Soumyashri. So,
Woohoo.
congratulations, everyone.
Congratulations, guys. You're doing.
Come back to YouTube Live. There are a few important things I need to tell you regarding systemic pediatrics, especially the important topics in the set of recent trends. Okay. say in CVS, okay, there is nothing more you need to know except the congenital heart defects and X-ray findings, okay. Not many questions are except Kawasaki disease. Kawasaki disease is again an emerging topic. That's why many questions are being asked from Kawasaki disease. Second, from renals, nephrotic syndrome, many guidelines have changed. Okay, there have been change in guidelines in 2021. So focus on definitions, especially. Treatment part is not much important, but definitions is very important. Definition of nephrotic syndrome itself has changed. Okay, so you need to know these things. Okay, because when you read from a book, especially which is old one, okay, before 2022 or 2021, you'll see no, you'll not see updated information. Okay, so that's why you need to focus on these specific things which are required. Okay. Third is from CNS, you don't expect many questions. Okay, there are very hardly few questions that are asked, but CNS again, there are no much recent updates that have come up. From respiratory system, again, topics on cystic fibrosis have emerged now and then. So cystic fibrosis, bronchiolitis, and always expect a question on HMPV. For upcoming exam, HMPV in children, human metapneumovirus, that is going to be one of the expected question. Okay, because of this increase in number of cases recently, you can get question on HMPV. Okay, even from pediatrics point of view. Then coming to GIT, not many questions are asked. A few congenital things are asked only. Okay, and a few important questions like IHPS and all are asked. Okay, coming to which system did I leave? Renals is done. RS
Cardiac.
is cardiac. I told in the beginning.
Endocrine.
Yes, endocrine, especially diabetes. Okay, diabetes, growth hormone related. There are many research going on in AIMS and all regarding growth hormone. Okay, so growth hormone related, thyroid related, and diabetes related questions are frequently asked. Pediatric rheumat. One important question is JIA. Okay, JIA is repeatedly asked sometimes. Okay, especially in INICET. So if you have any doubts, you can put in the comment section. So type C, TEF is the right answer. Okay, so Komal and Hema have mentioned the correct answer in the live comment section. EHT by Sabrina is also correct. Yes, the diagnosis was EHT in our case. Okay. So if you have any doubts or you want to give any suggestions, you can let us know. Tomorrow we'll be having grand finale of pediatrics at 10 p.m. So we'll be having 20 questions totally. Okay. So come prepared. We'll have total pediatrics, the whole of pediatrics. Okay. So Vishnu Priya sir, for ROP screening, we should answer according to IAP or Nelson. Answer according to IAP. IAP is a better guide rather than Nelson. But it depends on the exam setter finally. Okay. Because IAP guidelines and Nelson's, if you ask me, ideally it should be Nelson's, okay? But in India, we have modified guidelines for everything, okay? So what we follow in common practice is IAP guidelines. We don't follow Nelson guidelines. In many cases, I have seen, even in my setup also, in my hospital also, we follow IAP more than Nelson's. And AIMS has come up with its own protocol. So if the exam paper setter is from AIMS, then they'll follow their own protocol. If the exam setter is from another institute, he'll follow IAP protocol. So Meredith, sir, is this quiz schedule repeated? No, this quiz schedule will be repeated during revision session. Okay. So till April 15th, we'll be having first phase of preparation. From April 15 onwards, we'll be having a repeat session. That is for revision. Dr.
Guys,
Rupal and
we
Dr.
come.
Manoj, you want to add any inputs?
So just few more things. Guys, don't be afraid of any solving of PYQs or PY banks or anything that, comes as a question. You got to be not afraid. All right. So don't be afraid. And also we do repeat our sessions at exactly 10:10 quiz where it starts, and we start the quiz every night at 10 p.m. on different topics every day, small topic, so that you're able to revise and go with the flow.
Yeah, we are going according to the search schedule, and it will be very useful to you guys also as an accountability.
Right.
So, yes, sir, it's a good way to revise.
Yeah. So tomorrow we'll be coming up with the grand finale for pediatrics. So study well. Whatever you couldn't study from pediatrics, study it tomorrow. Okay. If possible, give a GT tomorrow. So that's it. We are going to conclude today's session. Good night.